Hello, Namaste. I'm Dr. Amit. This is my first video from the biochemistry series. If you are preparing for MBBS exam, NMC, Nepal PGME, or NEET PG, INI CET, USMLE, or AMC, then today topic, ethanol metabolism, is one topic you cannot afford to miss. So in the next few minutes, I will make ethanol metabolism extremely simple, exam oriented, and high yield. The questions are actually asked, the way the questions are actually asked in MCQs, okay? So let's master alcohol metabolism once and for all. So we can see in this equation that ethanol metabolism occur in two simple steps, okay? In the first step, ethanol is converted to acetaldehyde, and this process occurs in cytosol, and here the enzyme used is alcohol dehydrogenase, okay? And the second step is acetaldehyde is getting converted to acetate, and this process occurs in mitochondria, and the enzyme uses acetaldehyde dehydrogenase. And we can also see that in the both steps, NAD plus is getting converted to NADH, okay? Now we'll talk that there are three exam important points in ethanol metabolism. 1, 2, 3, okay? The first one is NADH to NAD plus ratio increases. The second one is NAD plus become the limiting reagent. And the third one is alcohol dehydrogenase. This enzyme follows zero order kinetics. Here the zero order kinetics means that alcohol is metabolized at constant rate. Whatever be the amount of alcohol, this reaction always occur at a constant rate, okay? Now we'll see that this increased NADH and NAD plus ratio leads to four metabolic effects. One is lactic acidosis, fasting hypoglycemia, ketoacidosis, and hepatosteatosis, okay? So now let's understand one by one how this happens using the metabolic cycle I have drawn on the next page. So now we'll see that how these cycles correlate with all these major metabolic effects that's occurring because of increasing NADH and NAD plus ratio, okay? So we all know that glycolysis produces pyruvate, okay? And normally this pyruvate can enter different metabolic pathways, okay? And we all know that when alcohol metabolism occur, the NADH ratio increases. So we can see here that if NADH ratio increases, then pyruvate is getting converted to lactate, okay? Because of this excess NADH, this pyruvate is preferentially getting converted into lactate, and while the other pathway gets suppressed, this pathway that pyruvate is converted to acetyl coenzyme A and oxaloacetate, this pathway gets suppressed, and this lactate pathway get activated more and more pyruvate getting converted to lactate, and this lead to this lactic acidosis, okay? Now we'll talk about how fasting hypoglycemia occur. Normally the pyruvate, this pyruvate get converted to oxaloacetate, okay, which is required for gluconeogenesis. As we all know, this gluconeogenesis process occur in liver, and this gluconeogenesis makes our body euglycemic in the fasting state, okay? But when the level of NADH levels are very high during alcohol metabolism, this oxaloacetate, okay, this oxaloacetate is converted to malate, and this decreases oxaloacetate, so gluconeogenesis is impaired and leading to fasting hypoglycemia. So high NADH shifts oxaloacetate to malate, and this block this gluconeogenesis and lead to fasting hypoglycemia. Now we'll talk about the third major metabolic effect, that is ketoacidosis, okay? So as we all know that the ratio of NADH and NAD plus increases, okay? So because of this high NADH, the TCA cycle blocked. As we can see here that the pyruvate is getting converted to acetyl coenzyme A, and this acetyl coenzyme A enters into the TCA cycle, okay? Enters into a TCA cycle, okay? So normally pyruvate converted to acetyl coenzyme A, and this acetyl coenzyme A enters into the this Krebs cycle, okay, TCA cycle. So most of the steps, these 3 steps, okay, require NAD plus, but as we all know, the NADH ratio get increased, so these steps gets blocked in the TCA cycle, and the TCA cycles didn't occur. So this acetyl coenzyme A is getting diverted to this step, okay, and due to high NADH, we can see that acetyl coenzyme is getting converted into acetoacetate and then to beta hydroxybutyrate, which and that lead to ketoacidosis. Now the last major metabolic effect is hepatosteatosis, okay. So we can see that normally the fatty acids are broken down by beta oxidations, okay, but in ethanol metabolism the level of NADH is so high, it inhibits the beta oxidations and no fatty acids get broken down, okay. So the fatty acids get deposited on the liver, and the second one is in the glycolysis, okay, the glucose is converted to glyceraldehyde 3-phosphate, okay, and then it converted into pyruvate. But when the NADH level is high, this glyceraldehyde is diverted to DHAP and more glycerol 3-phosphate formed, and this lead to increase in triglyceride formations, okay, and this triglyceride also get deposited in the liver, okay, and this leads to hepatosteatosis, okay. So we can say that high NADH promotes fatty acids and triglyceride synthesis, and inhibit the fatty acid breakdown, so more fatty acids and triglyceride get deposited on the liver, and hepatosteatosis or fatty liver occur. So we can see that this lactic acid doses, okay, lactic acidosis occur because the pyruvate conversion to lactate, and then fastic hypoglycemia because it decreases gluconeogenesis due to increased conversion of oxaloacetoacetate to malate. Then ketoacidosis because diversion of acetyl coenzyme into ketogenesis, and hepatosteatosis because increased conversion of DHAP to glycerol 3-phosphate. Now again the same steps as we have discussed earlier, okay. The ethanol is converted to acetaldehyde, and in this process the enzyme uses alcohol dehydrogenase, okay, and acetaldehyde to acetate, the enzyme uses acetaldehyde dehydrogenase. So here we'll talk about 2 drugs, okay, fomepizole and disulfiram, okay. So we use fomepizole in methanol poisoning and also in ethanol poisoning, okay. So this drug fomepizole actually inhibits this enzyme alcohol dehydrogenase, okay. So if this enzyme is getting inhibited, then no acetaldehyde formations will occur, okay. So so the fomepizole will inhibit alcohol dehydrogenase in both poisoning, ethanol or methanol poisoning, okay. And this disulfiram, this actually works over the acetaldehyde dehydrogenase, okay. So when the disulfiram will inhibit this enzyme, then there will be accumulations of acetaldehyde, and this will lead to hangover symptoms, okay. So and again we'll discuss this, that methanol is getting converted to formaldehyde, and the enzyme required over here is alcohol dehydrogenase, so we can give fomepizole so that this enzyme will be inhibited and no further action will occur, okay. Then this formaldehyde is getting into formic acid, and this formic acid will cause tissue hypoxia and retinal damage and electron transport cycles also. And at the last we'll this line, that the female are more susceptible than male to the effects of alcohol. Why? Because of decreased body size, because of decreased percentage of water in as compared to the body weight, and due to decreased activity of gastric alcohol dehydrogenase, okay. Hope in the next video we'll discuss more MCQ questions on ethanol metabolism. Hope you like this video and this so if you like this video, then please like and subscribe my YouTube channel, and stay tuned so that I can upload more and more videos.